Hello and welcome to this presentation on strengthening patients' referral with the use of smartphones. My name is Brenda Amuchi and I am a second year MPH candidate at Boston University School of Public Health. I'm going to briefly introduce myself, what I've done in the past and what I do currently, and then we'll dive into this presentation. Um, Okay, so as I mentioned, I'm an MPH graduate student and I'm really interested in infectious diseases and global health research. Currently, I work as a research assistant at Boston Medical Center at the Center of Infectious Diseases. And basically, what I do is screen and enroll patients and recruit patients for several HIV related research studies. Previously, I had worked with Planned Parenthood Federation of Nigeria, where we coordinated medical outreaches for vulnerable populations and hard to reach communities. So I can say that through my professional experience, I've gained considerable knowledge from working in resource limited settings and utilizing available resources to meet immediate health needs. The content of this presentation basically would include a background of, Mobi Health and Mobiland and Maycom and how all of these groups come together. And then I would speak about, I'll give a brief situation analysis on what is happening in Mobiland and how Maycom intends to improve healthcare delivery services through the use of smartphones. I would Basically, this is going to be done through patient referrals, and I'm going to briefly speak about patient referrals and the importance of proper patient referrals in Mobiland. And I'll dive into the the use of mobile health, how mobile health has um, skyrocketed in the past decade, and how it's a very useful platform for improving patient services and healthcare services in general. To do this, I've been able to create a deliverable that I'll share with you during this presentation, and I'm going to speak about that. And then I would also speak about how this deliverable can be implemented, potential challenges that may arise during the implementation process, and would conclude on the presentation rather. So, in a bid to improve delivery of health services, the Ministry of Health of Mobiland has, decided to supply Android phones to all health centers. And currently, there is no specific program to improve healthcare services in Mobiland. Maycom has come into the rescue and they propose to support the Ministry of Health by conducting a pilot test for an mHealth related application using the new smartphones. Maycom has identified several areas where mobile phone technology could, immediately improve service delivery. And of all the areas that were identified, we chose to focus on patient referral systems because there's currently so many loopholes with patient referral systems. And after lots of research and discussions were done with doctors and healthcare providers, it was identified as the single most important factor that limits service delivery. So we would be focusing on how we can use smartphones to improve patient referral systems. So what is patient referral systems? I'm going to speak about this very briefly. Basically, referral refers to the process of sending a patient from one facility, usually a lower facility, to another health facility for ongoing management. It doesn't mean that when the patient is referred to the new facility, they cut off services from the lower facility. It's just for ongoing management, and it's done with the expectation that the patients will continue to see the original provider in order to ensure continuation of care. So patients could be referred from community hospitals to district hospitals and then to regional hospitals, which is the case right now. Or they could be referred from hospitals to pharmacies or to laboratories, as the case may be. And so what's the benefit of patient referral systems? Basically, the benefit spans all through, the healthcare system, and it can be reflected on the patient, on the provider, on the health system itself. I've highlighted some advantages of patient referral systems to the patients and then to the health system. For the patients, it improves diagnosis and management of cases. It also improves patient outcomes ultimately. It saves cost and time, and it ensures continuity of patient's treatment. To the health system, it enables health providers to triage patients and provide care to those who urgently need care. It also generally improves efficiency of service delivery. And then what is mobile health? As we know, the healthcare system is a very complex network that involves a constant flow of information between the healthcare providers and the patients. And the use of mobile technology can definitely improve service delivery and enhance the efficiency of healthcare. So mobile health basically is the use of mobile technology in improving service delivery and enhancing the efficiency of healthcare. Information can move from the healthcare network faster with the use of smartphones. So, to help us increase patients' referral systems in Mobiland, I have prepared a deliverable that consists of a referral cascade. The aim of this deliverable is to build a referral cascade and utilize SMS or email. Basically, SMS email would be a second option, but for the purpose of this presentation, we would be focusing on SMS and to utilize SMS or emails to notify patients and designated staff at all tiers of the health facility each time there's a referral. So basically, each time there's a referral from the lower facility to the higher facility, this cascade would enable healthcare staff to send SMS messages to both the patients and the higher facility, and to also get feedback from patients and the higher facility. So it goes vice versa. Basically, a pilot study would be conducted in one or two communities in Mobiland. SMS referral templates have also been designed that can be used by the healthcare staff, in conducting this pilot study. And the overall goal that I had in mind when I created this deliverable was to improve the quality and comprehensiveness of referral systems in Mobiland. So the process of this cascade implementation would include training of healthcare providers on how to send SMS or emails correctly, increasing public health awareness about the referral system. So patients and healthcare staff should be aware of what is going on so that when they start to get these messages, um, they don't get offended or they don't get surprised, and then they also understand the importance of looking out for these notifications and following the instructions that come with the SMS notifications. So there's going to be some public health awareness on the referral system and the importance of referral systems. Um, the process would also involve ensuring proper patients registration and documentation of referral processes. So when a patient comes to see a provider, every information that would help the provider and the health system identify the patient properly should be obtained. So this may include phone numbers, dates, patients' medical record numbers, their dates of birth, proper diagnosis and proper record keeping just to make sure that the process flows properly. Obtaining consent to send SMS notifications and referrals. So patients would also be asked if would would obtain the permission of patients before we send out these notifications to them. Patients who refuse getting notified would not be notified because we have to ensure patients' privacy and confidentiality. And at the end of the study, at the end of the pilot study, we would conduct an evaluation to see what what results we get and to see if this is something that can be scaled up in several other communities. So I'm going to describe the deliverable briefly. I have a process map that is below in the presentation, but this would give you a general overview of what the deliverable entails. So the first step would be an awareness training and needs assessment. I had earlier mentioned that it's very pivotal for us to let patients and staff know about what's going to happen. So when they begin to get SMS messages, they understand the reason why they are getting these messages. So the first step would entail an awareness training and needs assessment. We would have to increase patients and staff awareness on the importance of referral systems. Secondly, we would have to conduct a needs assessment to identify communities that have very high referral rates and possibly pilot the study in these communities and then train staff on how and when to send notifications, how to track responses and feedback and record them properly. That's basically the first step. This will take between 1 to 3 months, depending on what we have available. But it's not a step that should take so long. Basically, it just entails training, creating awareness, and picking out a community where this pilot study would be conducted. Once that is done, we'd move to the second step of the study, which involves actually carrying out the study. Um, patients patients will be notified each time they have a referral. So if a patient has been referred from one facility to the next, they would be notified through SMS or email, depending on their choice. So to carry out this, we would have to obtain patients' phone numbers or emails when they visit the facilities. We would seek for permission to send patients SMS notifications regarding their referral appointments, and then we would send notifications at least 2 days before the actual referral visit. The next stage would entail communicating with the higher facilities and getting feedback. So it's basically a communication process between the lower facility and the higher facility. Um, in addition to sending patients notifications, the staff in the lower health facility would also send a notification email or SMS to the staff at the higher facility. So they are going to be um, designated staff who would occupy these positions and who would be able to track emails and messages and know what is going on. So a message would be sent to the higher facility on the actual day of the appointment. This message would let the facility know that a certain patient has been referred to their facility. It would contain some identifying information such as the patient's name, their age, their gender, or their date of birth, or even their medical record number. And it would also have a feedback system whereby if the patient shows up or doesn't show up or cancels the appointment or has been transferred, the higher facility with sent a message back to the lower facility concerning the outcome of the patient's referral or their visit. And then of course the responses will be recorded and stored in a database, because this is a pilot study, so we have to see the outcome of what we have to note the outcome. So every communication that happens between the lower facilities and the higher facilities would be recorded in a database. And then finally, the final section of this pilot study would involve the reporting and evaluation process. So to ensure this, we would maintain records on a monthly basis, and submit reports for evaluation and monitoring. We would also conduct a post pilot study evaluation Upon 1 year completion of the pilot process, we would identify loopholes in the process and strengthen, any loopholes, tighten any loopholes, and then scale up to the rest of to other communities. So I've created a template of what the SMS should look like. The SMS to the patient should basically, include the name of the community, sending the name of the community that is sending the SMS. So as an example, I have here Community Clinic of Mobiland. Hello, Miss Amuchi. This is a reminder that your referral appointment to District Hospital Mobiland has been created and is scheduled for the 12th of um for the 1st of December 2018 at 9 a.m. So kindly confirm why, if you would be attending this appointment, and if you want to cancel this appointment. This message basically gives the patient information about the date of the appointment and the time, and it also gives them options to either confirm if they would be showing up for the appointment or if they would be canceling the appointment. It also, you know, gives patients the option of canceling or stopping these text messages if they feel bothered by the text message or if they don't want the text message being sent to their mobile phones. And then the message to the health facility would also include the date and the time of the referral. It would also include a feedback system whereby the provider at the higher facility responds if the patient showed up, if the patient did not show up, if the patient cancelled, or if the patient was transferred. And finally, it would include information on how to identify the patient. So this could be at least two identifying information: the patient's name, their age, date of birth, medical record number, and so forth. So the components of this SMS, first of all, they are very easy to read, easy to remember as well. But these templates will be stored in a database, so the healthcare staff don't need to type out these messages each time they need to send them. They would be like an automatic system. All they need to do would be to change names and change dates or times of appointments. But this would be the general format. The SMS to the patient must be private and confidential. As you can see, the patient's diagnosis has not been included in this email. Nothing, private or nothing very identifying about the patient has been included in the email sent to the patient. It just basically includes the dates and the time of their appointment and options to cancel or to confirm the appointment. Um, the SMS to the facility would be sent on the day of the appointment, and it also includes feedback on whether the patient showed up or not. It does include personal identifying information because only the healthcare staff would have access to these emails. So only people who work in those designated positions would have access to these messages. So that's why it includes patients identifying information. And secondly, patients need to be properly identified. There may be two patients with the same name, so we would need an extra identifier to differentiate such patients. So that's why the SMS to the health facility has up to two personal identifying information, but the one to the patients has none. So requirements for implementing this process. The requirements are very simple. This is something that can easily be implemented in real time. Basically, staff need to be trained. We would also need to identify specific cell phone carriers, so that we can do some subscriptions. We could do annual subscriptions, quarterly subscriptions, or monthly subscriptions. To have access to the internet or to be able to send multiple SMS messages. We would need Excel, Microsoft Excel sheets as well, installed in computers because we'll be tracking um, patients' responses or responses from the facilities, and all this need to be downloaded directly to Excel. Staff would also be trained on how to do this, and then we would need to hire some monitoring and evaluation staff who would oversee the general process on a monthly basis, quarterly basis, and at the end of the study, who would also identify, any loopholes and correct them during the process of the pilot phase. So we don't wait till the end of the study to make corrections to the entire process. So this is a diagram and a chart flow that shows how patients would move and how SMS messages would also be sent, and it generally shows the entire process. So just to describe everything I've been saying, I'm going to walk you through the chart. So this is a patient who has just shown up at a community health center, and they've been evaluated and they need to be referred. So these patients would be referred to the district hospital from the community hospital. Now, the provider would send a message to the patient, notifying the patients of their appointments, their referral appointment date and time. This provider would also send a message to the district hospital, which is a higher facility, notifying them that a certain patient has been, referred to their facility, and would be asking them if this patient showed up or not. Okay. Now, if the patient showed up, then that's fine. But if the patient did not show up or cancelled, then there would be a follow-up process, follow-up emails and or messages would be sent. And then from the district hospital, supposing these patients required additional specialty care like a surgery, and they had to be sent to the regional hospital, the district hospital would also send a message to the patients, telling the patient about their referral appointment, and would equally send a text message or email to the regional hospital, telling the people at the staff at the regional hospital that a patient has been referred to them, would identify who the patient is, and would ask if the patient did show up for the appointment or not. Now, at every tier of the healthcare facility, so I mean the community facility, the district facility, and the regional facility, they would be collecting patients, they would be doing patients registration. So they would be, getting phone numbers and addresses, medical record numbers, date of birth. There would be proper documentation and registration of every patient, so that in order to avoid mistakes and unwarranted errors. They would also be seeking for permission to send patients text messages. If patients refuse, then text messages wouldn't be sent to those patients. Patients could refuse for a variety of reasons, ranging from privacy, confidentiality, or just not wanting to be bothered. They don't not wanting to be reminded about their appointments. So if patients refuse, they would not be sent any messages. No messages will be sent to the patients. No messages will be sent to the facility as well. um, once the registration and permission has been obtained and properly done, depending on the information or the response they get from the patients or from the facility, there would be these responses will be documented in the patient's records, just so that during the evaluation process, we can log into patient's records and see what happened during the referral process. And at the end of the study, reports would be made, and it's based on these reports that we would decide whether to scale this up or not. Reports would also be done on a monthly basis, or a cumulative report would be done at the end of the study. So the evaluation process would include a monthly report from the facilities to MACOM. So the facilities that would be chosen as pilot um, as for the pilot study rather would report to NACOM, and then there would also be quarterly meetings with the trainers, the providers, the M&E staff to discuss challenges and provide solutions to these challenges. Would try to obtain feedback from providers and patients so that we can see those are the people really involved in this process, the providers and the patients. We can see if they encountered any challenges and if they have any recommendations, moving forward when the study is being scaled up. And then we would conduct an end of study um, evaluation and definitely prepare to scale up depending on the findings we get from the pilot study. So, of course, as with every other implementation process on a program, there are bound to be a few challenges, and we anticipate that because staff are poorly trained on mobile health in general, there's very little expertise in this area, so we may take additional time training staff on this. Um, as with every technology, there's the possibility of low adoption. So this may just be something that patients are not interested in doing, and we may just have a very low adoption rate. That's a possibility. Um, there may also be poor tracking or communication between the different levels of the health system. There are issues that may arise from privacy and confidentiality. So if people bump into other people's text messages and see that they have hospital appointments, those may raise concerns. This isn't much of a challenge, but there might be some challenges with cost of SMS in the long run, and then access to internet for emails. That's just for emails. For now, we are going to be focusing on SMS messages. But if we decide to do emails, we would need like internet subscriptions for all that, and those may, incur additional costs. There's still lots of people who don't have access to internet. At least 50% of the world still has low access to internet, and this may be a problem if we decide to go for the email option. However, we would be focusing on SMS messages. But if we decide to, if you decide to go for the email option, that's a possible challenge that there would be poor internet access, so we would need to like spend more money on making sure that these emails are sent. For patients, that would also be a problem because not every patient has access to internet, and that is something that we may not be able to control. So I would advise we stick to SMS messages, at least for patients, and then for providers or to facilities, we could do emails. But for patients, I think it's best to stick to SMS messages. So, in conclusion, I think that this is a relatively cheap and effective way of improving referral systems through the use of smartphones. It's cheap, it's relatively cheap, it's easy to implement as well. And I must say that there's a high tendency that it would be adopted. Just with technology, it's either a hit or a miss. Smartphones have been highly adopted worldwide, and lots of patient appointments are sent through text messages. So I'm quite confident that this would be well adopted. For our next steps, it's important to begin the public health awareness, so letting patients and staff know the importance of patient referral systems. And we can start conducting a needs assessment to identify communities that have very high referral rates, and decide on which communities to do the pilot study in. Thank you so much for your attention, and thanks for listening to this presentation. If you have any questions concerning this, kindly direct them to my email at bcamuchi@bu.edu. Um, Below are some of the references I used in preparing these slides, and I really hope to hear from you concerning this. Thank you.